started going to the YT seminars pretty early. I forgot when my first year was, maybe 2000, I don't know, 12, 13, something like that. I had to double check, but I've been to 3 of them, and I've sent my office staff as well. I think at the time, I was just starting my practice and I wasn't ready to commit, financially I wasn't ready. And just like, as far as like how busy we were, I wasn't ready either until finally came to a point where, I realized that was a big lack in our practice, just like proper sales training, and just like a higher booking ratio. So that's what kind of like drove me to decide to sign up with YT eventually. One, with YT, it feels like you have like, a VP of sales that is managing your sales staff. Even though we're a very small business, you wouldn't have that type of position. So it decreases the burden on us. Myself, I get to focus on doing surgery. My wife runs the practice and the business. She can focus on, other things like marketing, HR, surgical center stuff. And to have that, follow up, John meets with our patient care coordinator once per week, which is really great. I mean, and to go over each single consult, and, it just relieves a lot of that managerial pressure to just check in with the patient care coordinator and make sure that they're doing a great job. So, peace of mind, saving time, and also just expertise. I do read sales books and things like that, but I'm not an expert like, John is. So to have that kind of authority, managing that person just makes my life a whole lot easier. The thing I like about John is that, he's very direct and very matter of fact, and a lot of his suggestions are data driven, which, sometimes you may or may not like some of the suggestions, but they're rooted in some sort of data and reasoning, and it does work. And some of the things that may seem counterintuitive really do work, because as humans, we make decisions based more on our emotions rather than like rationality. So I think what he brings to the table is a lot of experience to help kind of ease that process for us, and not take things personally or anything like that. It just ends up working out really, really nicely, because the methods do work, and they work very, very, again, effectively. But once we found our patient care coordinator that's been highly effective, I mean, our sales numbers we've just been crushing our numbers since especially compared to last year. I mean, more than doubling what we did last year, which has been really effective. And I understand the pandemic can help a lot of plastic surgeons, but at the same time, our particular patient coordinator that we have now is just so effective. I mean, she answers all the leads. She gets back to all the leads in a timely fashion. She follows the YT method without being stubborn or, oh, this is how I did it at my last job. And I think that's really helped drive our sales numbers up. And again, reduce wasted time with people who either don't show or don't want to book. Or I think John has the numbers, but it's somewhere on order of like 95%, basically. Same day booking ratio. And those off, because they're so well prepared, the off times where people don't book is either there's a slight deviation in the YT method, or they just don't share some critical information that, for example, like someone else is paying for their procedure or things like that. So saying that the additional benefit, other than having increased sales with, just with the YT method is the amount of time that's saved. I think people place a lot of importance on their sales numbers and money, which is obviously very important, but they don't value their time as much. And if you need to see 4 or 5 consults to book one surgery, you're wasting 3 to 4 hours of your time, which can be so valuable doing other things. You could be learning how to be a better surgeon. You could be interacting with your office staff more. And then also just that momentum is so slow and so lost that it can kind of affect you. So it's a compounded effect when you're wasting so much time seeing patients who are not serious about surgery or have not been prepared long enough. And in addition, although like the phone calls can take a long time, somewhere between 15 to 30 minutes when a patient calls for an initial consultation, the feedback that we get from our patients is, wow, I've called probably the 3rd office I've called, or 4th office, or whatever number it is. And this is by far the best phone call I've ever had. I'm so excited to meet Dr. Nima, and I can't wait to book my surgery. And, you can't, it's hard to put a price on that. You know what I mean?
Yeah.
So one of the hesitations that I think a lot of doctors have with signing up with YT and the contract that they have is, one is the cost of it, do I want to pay this much per month to sign up? And the second is the length of time of the commitment of the contract. So, obviously there's so many different ways of justifying the cost, but in general, again, like if you're saving time, your booking ratios are ridiculously high. You do not have to like actively manage that person as much, especially in a field that's not necessarily your expertise. That monthly cost is already worth it. I mean, plus the education that you get from just kind of like osmosis from hearing about how John manages the patient care coordinator. That information is invaluable. Yes, it's not an inexpensive commitment, but what you get out of it is just well worth it. It's valuable and it pays for itself, I think. And as far as the length of time and commitment, again, like everybody has a business. I understand there's a lot of upfront costs when it comes to finding a patient care coordinator, and that's a huge deal. I mean, like people are like the hardest thing to like hire and find and make work out. It's not very easy, especially in California, to just hire people, try them out, and then like fire them if they don't work out. Like that's really not feasible. You really have to do a lot of upfront due diligence before you hire someone, because it is very difficult and awkward to if it doesn't work out. And you guys provide such a great service of finding someone. And if you go to any kind of like headhunter or any kind of consulting company to help find someone, that alone costs tens of thousands of dollars to find somebody. And I know that once our contract is finished, we're going to continue going forward because it just provides such a valuable resource.